So we're very thankful, very grateful for Tracy Hammer for presenting today. Tracy Hammer has been a nurse at the Pediatric Disorders Clinic since 2009, and she's also worked as a nurse at the Adult Movement Disorders Clinic. Since 2016, she's been a clinical research nurse for the Parkinson's Disease Cognition Action Lab and for the Calgary Parkinson's Research Initiative. And prior to entering the nursing profession, Tracy was a civil engineer in transportation planning. So I therefore hand it to you, Tracy.
All right, thank you, Julian. And thank you everyone for joining us today. As Julian mentioned, I've worked in movement disorders for quite some time, for the last 12 years, and I've actually really enjoyed it. I've enjoyed going into work every day. And my role in clinic is that for new patients, at least, I'm booked to see them before they see the neurologist. And so I do things like make sure their screening forms are completed. We screen for comorbidities like ADHD, anxiety, and depression. I also teach families about TICS, assess their TICS severity, provide resources, and also introduce any relevant research studies. So I've really enjoyed working with our patients and families. And part of that is because I could feel like I can relate to them on a bit of a personal level as well, just due to my lived experience. I'm parenting 2 children who between them have many of the challenges and the patients that we see. So just from my lived experience, I feel like I have a lot of empathy for our families, and it just helps me really appreciate the patients that we have. So we have some pretty amazing patients. So I'm going to share a bit about you today with the journey of the lived experience that families go through when their child is diagnosed with TICS. And TICS really do impact families, not just the child with TICS. Then I'm going to share about what families consider as they decide on a treatment plan or to not treat. Then discuss how we can support families with TICS through a function-based assessment and intervention approach, and also how we can provide other kinds of support. Because as healthcare professionals, we do have the opportunity to provide meaningful support for our patients and families. And it is important to support our families to help them meet the extra challenges of parenting a child with TICS. So before a parent knows their child has TICS, they might go through a discovery period. It does usually take time to figure out that it's TICS. It can take years even for a child to receive a TIC diagnosis. And families' initial experiences with the healthcare system impact how they adjust to having a child with a TIC disorder. So understanding that journey can help guide clinical care even. So I think it's just worthwhile to just explore this experience a little bit. So at the beginning, parents usually notice changes in behavior, movements and sounds, and they wonder what they are. Sometimes it's just chalked up to bad behavior and that the child is choosing to do that movement or sound. Sometimes parents even might get upset by the behavior, wonder why their child isn't listening, ask their child to stop it, which actually can make the tics worse just because of the suggestible nature of them. And also, sometimes families do know right away that their child is having tics because they might see it in other family members because of the potential genetic link. And also in general, there's increased awareness of tics over time. Parents, really their first experience, and this is what we see, is that parents are worried. They're concerned, they're trying to find answers. They might see their doctor or go to the Emerge. And parents also might take to social media and the internet and try and figure out things. They just wonder why. And there is a lot of misinformation out there. So just to clarify, stress on its own doesn't cause tics, although tics might increase during periods of stress or excitement. Parents will often hear about the diagnosis of pandas, which isn't actually that common. We've only had a few of our patients with tics that we think actually meet this criteria. But it's interesting to me that some parents kind of get fixed on a diagnosis of pandas sometimes, and it seems like they would rather, I've had some parents share that they'd rather have their child's tics caused by pandas and have them on long-term antibiotics than actually having a tic diagnosis. So that was interesting to me. And sometimes tics do coincidentally start when ADHD medication is started as well. So there's just a number of things that parents look at. And parents really, it's the worry that we notice with parents often. And so children often end up being seen by multiple specialists prior to tic diagnosis. So even though tics can be any kind of movement or sound, they're usually fairly predictable in their presentation. They usually start with simple motor tics prior to vocal tics, and complex tics are usually not seen in the absence of simple tics. It's more common for tics to start in the eyes and face and head first. And just through this journey, parents might see a few different specialists before they actually get a diagnosis of tics. So, and when that diagnosis happens, caregivers can experience a range of reactions to it. Some are relieved that they finally have an explanation. Some are upset because it's taken so long to figure things out. And increased time from tic onset to diagnosis can result in increased caregiver stress. For example, did the caregivers understand that the child's tics were involuntary? The child could have been punished for ticking. So we need to advise parents how to respond to tics in a healthy and effective way. Parents will often have a lot of questions about diagnosis or be worried about the future, and there's a potential genetic link, or parents might feel guilt or blame themselves or their partner for the tics. And sometimes there is a bit of a family link, a genetic link with tics, and I found it interesting as well. I've noticed several times parents with tics don't even know that they have the tics, because when we ask them if there's a family history of tics, they say no, even though they're obviously ticking in front of us. So I found that interesting as well. So as you know, in medicine, we like to label everything. So, the labels for tic disorders change depending on how long a child has had tics and whether or not they have motor and or vocal tics. And basically they're just labels. One thing to remember with parents, so I've had some parents get upset when their child is diagnosed with Tourette syndrome because they thought their child just had tics. And so I think it's important to remind parents that no matter what the label is, it's just tics. And we just like to label things. And I just wanted to clarify as well, or share that, so tonight, Tamara Pringsheim and David Martino are doing a presentation, a webinar, with a new thing that we're seeing lately in clinics. So we're seeing a lot of referrals for teenage girls that have had a sudden onset of acute tic-like behaviors during the pandemic. So that's kind of a recent thing. So I just wanted to share that they're doing that webinar tonight, and the information about it's available on the network website. So the diagnosis is usually provided by a physician, but even with physicians, it's not always clear whether the movements and sounds are tics or not. For example, they might be things like stereotypies or compulsions or behavioral or functional. Even though it's challenging though, it's important to try and teach families how to differentiate tics from non-tic behavior so that caregivers can respond appropriately. So sometimes, like I said, it's hard to tell the difference between tics or comorbid symptoms or what's developmentally normal behavior. And it is easier to usually identify more simple tics than complex tics. I won't get into the details too much. Tamara Pringsheim's psychoeducation webinar provides great information about how to identify tics. And now that we know it's tics, what's next? Now what? So the first thing first intervention that's really helpful for families is psychoeducation. It's really important for families to have accurate knowledge about tics and their natural history and the relevant comorbid disorders. And as I mentioned before, there's a lot of misinformation out there. So we want to ensure that our families have reliable and accurate knowledge. Learning about tics is a key early intervention. And because we see so many worried parents and children, and psychoeducation is just really reassuring. And this psychoeducation a family receives really influences how their family is affected by tic disorders. So I know most of you are well educated about tics and through the webinars and just through your experiences, but I just wanted to highlight some of the take-home messages that I share with families. So because parents are often worried and anxious, I try to share some of the messages that are a bit reassuring. Even though it's a strange thing to say, I usually share with caregivers that the tics themselves won't damage their child's brain. And it is really helpful for families to know that tics change a lot over time, and they do have a high rate of natural remission in their late teens. So that's a nice positive message for families. It's actually something that usually gets better over time after that peak teen period or early teen years that unfortunately are challenging for many other reasons as well, for teens and for parents. And there are many factors that can increase tics, like for example, kids use the word stress, but it's really any unsettling situations or changes, or when they're anxious or excited, when they're thinking about tics. And I've had several families share with me that their child's tics were the worst ever when they were at Disneyland, which I found interesting. I know there's not many trips to Disneyland going on these days, but I thought that was interesting. And before the pandemic, where we've had a higher number of referrals for teenage girls, definitely we saw more referrals for boys. About 75% of patients referred to tics were boys. And I do ask about premonitory urge as just because of the implications of CBIT as a potential treatment option if there's this premonitory urge. So tics can cause different challenges like pain, which can be something as simple as eye strain just from having a lot of blinking, to headaches from repetitive head movements, to self-injurious behavior, which is actually quite common. So it's just important to be aware of that. Children might be embarrassed by tics and impacting their self-esteem. Tics can be really disruptive or distracting, especially to activities in the household or homework. So tic morbidities are also common and have a greater impact on the quality of life than tic severity even. So it's important to be aware of comorbidities. And as I mentioned, yeah, the numbers are quite high for comorbidities. And these are numbers from Tamara's psychoeducation presentation. And so, as I mentioned, tics and comorbid disorders can really affect family functioning. So when tics impact a child, they really are impacting the whole family. And there are many different ways that tics can impact families. As I mentioned, they can be really disruptive and limit activities from schoolwork and household activities. They might also lead to avoiding different activities or even for the child to be excluded from family activities. And while many children with tics are not bothered by them, for some, they're a cause of a lot of embarrassment. Tics can really impact parenting and family life. because parenting a child with tics may be a really different parenting experience. It can take more time and energy, cause conflicts, raise different concerns, and just be really exhausting sometimes. Siblings might also be impacted by tics. It might be difficult for them to ignore or cause conflict between the siblings. And tics can also cause conflicts with the extended family or even with schools as well. And really, comorbid disorders can also impact family functioning. I won't go through the details of these too much, but the extra challenges from comorbid disorders really require extra parenting efforts and can cause caregiver distress depending on what's going on. And so there are different options to treat tics, both medication and non-medication options. And this discussion doesn't go into depth about the types of treatments available. I just wanted to share a bit about how we can support families when they're considering treatment. So it's important to help families make informed decisions that are in the best interests of their child and family. It's really a collaborative decision between the clinician and families. And really, what are the family's treatment goals? That's an important first step, is to figure out what their goals are. So it's important to also manage families' expectations. It's important to be aware that treatment might reduce tics and improve quality of life, but it usually won't completely eliminate them. And so this teaching is important so families really understand the potential benefits and pitfalls of different treatments. And it is important for families to consider treatment if their child's tics are causing functional impairment. So functional impairment isn't just about tic severity, but it's also about how a child feels about their tics. So their tics might be causing them distress or embarrassment or social challenges like bullying. And in these cases, it's important to consider different treatment options. And as Tamara Pringsheim noted in her presentation, watchful waiting is an acceptable approach for individuals who do not experience functional impairment from their tics. So often in our clinic, we see families once, and then if they're doing fine, we don't hear anything. And then a few years later, we'll hear back when their tics are worse and maybe causing impairment at that time. And then we reassess. So I'll start with the non-medication options, which include comprehensive behavioral intervention for tics, or CBIT. And it can be a very effective initial treatment option. And it may be more appealing to parents who are less willing for their child to take medication, but it does require a significant commitment from the child and their family and guidance from a trained therapist, whether it's in person or virtual, like through tichelper.com. And Gabrielle Wilcox has a seminar on the Tourette OCD Alberta website with more information about this that you can refer to. And sometimes if CBIT isn't available, exposure and response prevention might be helpful. And Tamara Pringsheim in clinic, we looked at the impact of diet, sleep, and exercise on tics. And one of the conclusions of the study was that we found that exercise can possibly reduce tic severity, anxiety, depression, and obsessive compulsive behaviors. And there are alternative therapies out there, and often parents will seek them out, even though many lack empirical support. These include things like dietary supplements or acupuncture, massage, or chiropractic. And I just wanted to share as well that Tamara is doing a webinar on this for families on June 16th. And deciding whether or not their child should take medication is a big decision for families. And it is a big deal. And with any medication options for tics, It requires families to make a commitment to monitoring. So we'll need to see those patients in person. For example, antipsychotics, we need to monitor fairly closely for neurological and metabolic side effects, which requires in-person visits and blood work, especially early on. For the alpha agonists, we'll require monitoring postural vitals or maybe an ECG. And obviously for Botox injections, patients need to come in person. And really, families need to feel supported if they're prescribed medication to treat tics. So there's different challenges to treatment. There might be a reluctance for families to consider prescription medication. Different family members may not agree on treatment options. And it may be difficult for some children to participate in some of the types of therapies. Resources might be difficult to access. There's different barriers to different treatments. So we're hoping with the Tourette OCD Alberta network to try and make treatment more accessible. And the website has a list of therapists who are trained in CBIT. And it also is important to treat comorbid disorders as well, because these can potentially significantly impact children and families too. So, but this sometimes there's different priorities. So it's important to prioritize what treatment options are. For example, a child might have ADHD that's poorly controlled, which would make CBIT difficult, or a child's anxiety or low mood might be more pressing than treating their tics. So tic reduction really isn't the only goal of treatment. Even with tic reduction, caregiver strain, family functioning, and comorbid symptoms can still pose challenges. So keeping this in mind, a function-based approach and intervention is a very practical approach that families can take to effectively manage problematic tic exacerbations. So there's evidence that this function-based approach can decrease functional impairment caused by tics. And the theory behind it is that tic severity is influenced by different factors, which include things like internal mood states. So a child's tics are worse when they're struggling to regulate their emotions, and they might have worse tics when they're feeling anxious or excited or bored or tired. Also, the tic severity can be influenced by external factors like different settings or activities or with certain people. And then there's reactions that are called tic contingent reactions. So they're what happens as a result of the tics that make the tics worse. So these factors don't cause the tics, but they can increase them though by reinforcing the tics. And that's in part due to the suggestible nature of tics. Really, the premise of this type of therapy is really about problem solving and finding ways to practically reduce tic severity and the impact of tics. So the first step is assessment and identifying factors that are associated with problematic tic exacerbations. And for example, during what specific situations are the child's tics worse? And then the next step is intervention. So once you know what situations make the child's tics worse, you modify the setting and change the reaction to the tics, which requires careful consideration. Function-based interventions need to be practical and specific with the goal of improving family functioning. But the family needs to have the ability to implement them. And also for some tics, for example, self-harming ones, they cannot be ignored. So here's a list of some examples of function-based antecedent interventions. So antecedents are the situations in which tics happen more often. So for example, if a child has much worse tics when they're anxious, it might be helpful to provide relaxation and coping strategies to help manage their anxiety, or or really anything that helps to manage their anxiety. Or if a child has worse tics after school, it might be helpful for them to do their homework instead when they're less likely to tic, like in the morning, or adjust their routine for that. Or if a child has more tics when they're watching TV or playing video games, maybe possibly minimizing screen time or adjust the timing of screen time so that the important tasks are done first. And so these are some examples of function-based consequence interventions. So consequences are what happens as a result of the tics that actually makes the tics themselves worse. So which includes attention from others, like when parents are closely monitoring tics, for example. So it might be helpful to teach parents to selectively ignore tics, again, as long as they're not self-harming or causing other problems. For children that avoid activities like homework, especially things like homework and chores, it can be helpful to provide breaks and adjust the timing, as I mentioned, and to try and have the child push through the tasks as possible, because avoiding the tasks actually will increase the tics. So it's important not to avoid them. So there's an example that was provided in the book that I'm just going to mention in a minute, that I've gotten a lot of my information from. And basically just wanted to give a quick example to share that it's basically simple problem solving and strategizing to do these interventions. So this is an example where Johnny has more severe vocal tics at home after school. He avoids his homework and goes to his room to watch TV and stays in his room through dinner. So as a result, he's falling behind at school, which causes conflict with his brother because his brother still has to do homework, and it makes it difficult to do family activities. So the things that made his tics worse were that a peer on the school bus was teasing him, and so adjustments were made to eliminate that teasing. His mother was giving him a lot of attention when he arrived home from school, like expressing frustration about his tics, and so her plan was to ignore the tics after school, and Johnny was avoiding TV or homework because of his tics and gaining access to the preferred activity of TV. And because of this, his brother was acting out as well. And so as a result, they changed to implement a reward program for Johnny and his brother to earn TV time for completing homework, and scheduled his homework time to morning when his tics were less severe. And also the intervention for the family was to regularly engage in different activities regardless of how severe his tics were. And these things were also to be done with other activities to reduce tics, like CBIT and anxiety management. So as I mentioned, I got this information from the Family Issues Associated with Tics, the Clinician's Guide to Treatment and Management of Youth with Tourette Syndrome and Tic Disorders. And for a more thorough outline of what this information is, or this treatment is about, it's provided in the CBIT treatment manual by Douglas Woods as well. And there's a webinar provided by Jennifer Ference-Balam for parents on managing avoidance and accommodation of complex tic-like behavior. So that's coming up on June the 3rd. I just wanted to mention that. And so there's other less formal ways we can support families of children with tics as well. And many of these are things that we already do as clinicians. So when parenting a child with a tic disorder, it's often easy to focus on the challenges and the negative aspects, but it's important to focus on the child's strengths as well. So that creates a sense of accomplishment for the child and improves relationships with parents and decreases parental stress. So it's also can be helpful for families to spend time on preferred activities, including activities that they've been avoiding due to tics. And it's important to teach families ways of talking about tics with others, because families and children are often embarrassed by tics, particularly ones that are loud or noticeable or socially inappropriate. And so educating others about tics can increase positive attitudes and acceptance of children with tics, but also conversely, making excuses or apologizing for the child's behavior or avoiding public places can lead to the child feeling shame about their tics. So it is important for families to learn healthy ways of talking to others about tics. For example, it may be helpful for a child to have an explanation already prepared for sharing about tics with others. And the Tourette Association of America has great resources for helping families educate others about tics. And I found this on this card on their website. It's supposed to be for your wallet, and I thought it was interesting. So it just shares, it's the I have Tourette syndrome information card, and there's a new COVID version with information saying that you know, they might be coughing or sniffling or throat clearing because of their tics, not because they have COVID. So I thought that was interesting. And it's on their website. And it's important to help families, or to help families advocate for their child's needs at school as well, which we can do by providing a diagnosis letter and in support of accommodations with an IEPP. And or we now have the option of having an in-service presentation done, which Julian does right now for schools. So Julian's available for these. And these presentations can really change how peers and teachers interact with the child with tics. So they're a positive support. And it is important to encourage parents to take care of themselves, so that so that they're able to care for others better, just because of the increased demands on caregivers especially. And so I've thought a lot about what I find helpful personally as a parent of children with different challenges, and because it can really feel isolating and lonely at times, and like other people don't understand your experiences. So for me, feeling supported by others and having a team of people to help provide support in different ways is very impactful. And having access to appropriate resources can make a big difference. Social isolation can be a source of stress for families managing tic disorders, so it's important to increase social support for families. It is more challenging, though, to make these connections during the pandemic, which has also caused extra stress for everybody, I think, for most people. And stress and negative life events are associated with increased tic severity and worsening comorbidities. And so, but I do find it interesting that some of the children I've talked to with tics are also happy to be at home more because they can tic safely at home. But in general, I would say that the pandemic is having a significant impact on mental health with the increased stress and anxiety. We're seeing patients that are just not functioning as well with their mental health. We're seeing more increased functional tic disorders as well. And it's just more challenging to access mental health resources these days, which I know you're all well aware of, just because of the increased demands due to the pandemic. So families of children with tic disorders do have higher medical, mental health, and educational needs than other children. So it is important to direct families toward appropriate resources in the community, which they vary from community to community. Some are localized, some are centralized. It's just important to know what's available in your community and direct families to appropriate resources. And there are more virtual options available than ever due to the pandemic, which is one good thing from the pandemic. And I wanted to share that the Tourette OCD Alberta Network website does have great resources provided for families. And it is also important to refer to appropriate specialists just because of the increased care needs of our population. And it is important to try and coordinate this care if possible to reduce the burden on families. I mean, it would be really nice to have a fully coordinated interdisciplinary care, but it doesn't really exist in the real world in most cases, I would say. Hasn't been our experience. So it can also be helpful to identify and reduce the barriers to care, like costs of medication or treatment. And again, the types of specialists available will vary throughout the community, vary from community to community. So it's just important to know what's available in your community. And the directory of healthcare professionals who have interest in Tourette syndrome or training and OCD as well are provided on the Tourette OCD Alberta website. And so I wanted to leave the presentation on a hopeful note. And I think it is important to reinforce hopeful messages with families. So tics are common. Families are not alone. Tics usually do get better into adulthood, so that's a good thing to keep in mind. And there are great resources and support available. It might be hard to access sometimes, but they're available. And we do, as healthcare providers, have the ability to meaningfully impact the families we work with. So we do have the opportunity to make a difference. And yeah, I think one of the great benefits of the Tourette OCD Alberta network is to help provide support to families and resources for families affected by tics. So that's another message as well. So there's one more positive support for families. So that's actually the end of my presentation, but I would love to have a chance to chat more or take any questions or have discussion.
Wonderful. Thank you very much, Tracy. While we're waiting for questions to come in, I will just launch the second evaluation. If while you're thinking about the type of question you might want to ask Tracy. Yeah, so we'll just hold on a moment.
So I can't see if there's any questions. I think, do I have to stop sharing the screen to be able to do that, or?
If you go to chat, I mean,
or can you read them out for me, maybe? Just the way my screen is set up, I can't see.
Okay, no worries. If they come in, I'll certainly read them out to you. I've also unmuted the attendees, so if you would like to actually say a question directly to Tracy, that's possible too. Either way is fine.
Okay.
Can you see chat, Tracy? No?
I can see it now. So I stopped sharing the screen and I can see now.
Okay. You see that?
Yeah,
Tracy?
so I see a question about rage attacks, which I didn't mention specifically. So we definitely do see that as well with tics. And it's really because the brain just has a hard time regulating and shutting down those different thoughts and behaviors. So we actually do have some resources we recommend for that. There's a book called Parenting the Explosive Child, and I believe it's listed on the website as well. And I'm trying to remember it's by Ross Green, I believe. And there's a website called Lives in the Balance as well that provides some great information and resources about that. It's definitely common for the rage attacks and emotional dysregulation as well, partly because of ADHD and the comorbidities. and increased anxiety often in the children that we see, and also partly the behavioral things like different defiant behaviors that we can see as well. And so sometimes those challenges are honestly more difficult than dealing with the tics in some ways, right? So yeah, I understand on a personal level that one for sure. So but there is support available. Like I said, Ross Green has a great book about parenting children with rage issues, and it's listed on the website under the resources, I believe.
Yeah, it is on the website. I can't remember exactly where, but it is there. Yeah.
Yeah. Okay, so there's a question about watchful waiting, and transient tics can be common. And so one of the things in our clinic that I think is a bit unique to our clinic is that we'll see a child once and then provide some psychoeducation, and things, again, they change over time. And so as things change, it's important to respond to those changes. And so we're open to seeing a child many years after their original appointment, even without requiring referrals. So parents can contact us, and we'll book in an appointment and without needing a new referral, because we understand that tics change a lot over time. And so sometimes a child will never need treatment for their tics, and sometimes they will eventually, but just not yet. So that's why the watchful waiting is one of our strategies for sure. Many of our patients fall into this category. So, and as a nurse, I'm always open to having parents follow up with me if there's any questions or resources or things that they need over time as well. So, because things do change a lot, right?